even after a crash or a smaller incident, travelers, you may be one of them, become more concerned about getting on an airplane. The National Institutes of Health, in fact, says that 20 million Americans have a fear of flying. Some even they change their jobs, they give up their hobbies, all because of it. But behavioral specialists are coming up with a number of ways to help people get back in the air. Brian Innes is here. So, Brian, I understand that one of the methods puts patients actually through a virtual flight.
That's exactly right, Heather. You know, about a third of people say a recent crash or accident makes them less likely to fly. And psychologists we spoke to say their phones ring off the hook following a plane crash or mishap. The news is a trigger for those with aviophobia, the fear of flying, enough to turn an already anxious flyer into a downright miserable one.
I would get sick before I went on the airplane. I would get sick on the airplane. I would have to drug myself. I would buzz the stewardess. I would ask to see the pilot. I couldn't breathe. It was horrible.
Horrible until Alice started virtual reality treatment in 2009. Patients put on 3D glasses. Their heart rate and breathing is monitored as they experience a virtual plane ride from takeoff to landing with real jet noise, shaking like turbulence, even thunderstorms.
It's often referred to as anxiety inoculation training, just like a flu shot. You know, you get a flu shot, that's an inoculation. They give you a small dose of the disease, your body fights it off, so later on when you get exposed to it, you've had prior experience in dealing with it.
Patients learn to control their bodies, deeply relax. It's called biofeedback, like lowering your heart rate during bad turbulence. And Dr. Reiner says the treatment has a 92% success rate. Alice says it's life-changing.
6 hours is nothing for me. I flew to Paris and London and back, and I'm totally fine.
Now, patients usually need 12 to 16 hours of therapy, Heather, but it's not cheap either. One session costs $200 to $600.
Yeah, and this latest incident with Germanwings is not going to do them any favors. This sounds like it's a good idea and it works, but what about some other ways that people can cope with their fears?
Right. So experts say, you know, very few fears come from the actual fear of having a catastrophic flight. Much of the anxiety comes from fearing that you'll lose control and have a panic attack on board. Renowned psychologist Dr. Martin Seif recommends a couple of things. You know, share your secret. Let a flight attendant know about your fear. They may give you extra attention. Learn about airplanes. Knowing how a plane flies and what various sounds mean, it helps. And just keep flying. Expose yourself to the fear and be thoughtful about reducing anxiety. Now, overall, quick fixes, distractions in, you know, movies and reading books, sitting in the front of the airplane. You know, there's less turbulence there. And ultimately, though, avoid caffeine, alcohol, and those anxiety pills, because ultimately, it's just a mask. You're not actually solving
really?
the problem.
Okay. Well, that makes sense. Yeah, I always try to sit closer to the front because I get motion sickness.
Oh, okay.
Not fear, but the motion sickness.
Okay.
So thank you so much,
problem.
Brian. Appreciate it.
Take care.